Hello. My name is Tumo, an information systems student. And yes, I am that nerdy type who never liked presenting in front of large groups of people. I would rather stay in my den and write code all day long. But hey, since I have mustered enough courage, let's talk about my project pitch. What patient care challenges do you face today? Are you looking to simplify life for clinical staff stretched to the limit? Or remove complexity as a barrier to faster decision-making? Or reduce variability in care delivery? Or integrating emerging technologies with your systems and electronic medical record? No matter what your challenges are, they all revolve around your ability to watch over your patient and provide the best care possible wherever it takes place. Monitoring health at home is a difficult task in the modern age. This is a problem especially for patients who need regular checkups, such as old and chronically ill people, as their health have to be monitored and doctors informed of their progress. Hospitals are full due to patients that do not need to be there, and this is a waste of time and resources. My proposal to this problem is a smart patient monitoring system based on IoT. First of all, the Internet of Things, IoT, describes the network of physical objects or things that are embedded with sensors, software and other technologies for the purpose of connecting and exchanging data with other devices and systems over the Internet. IoT allows companies to automate processes and save money on labor. It also improves service delivery, making it less expensive to manufacture and deliver goods and providing transparency into customer transactions. The system I am proposing uses a set of sensors to keep track of the patient health condition. The sensors used are for temperature, heartbeat, blood pressure and humidity, which are connected to a microcontroller which analyzes the inputs from the sensors. If any anomaly is detected, the patient and the caretakers connected to the system are immediately alerted through mobile. The results are recorded online for future analysis and review of patient health condition. Health monitoring is very essential to human life. The constantly growing geriatric population is expected to drive the growth of the remote patient monitoring market. According to the World Health Organization, the share of the population aged 65 years or over increased from 6% in 1992, 9% in 2019, and this number is projected to rise further to 16% in 2050. The pandemic had positive impact to the market of health monitoring systems as a result of the pandemic. During March 2020 and throughout the second quarter of 2020, access to customers to sell and implement the patient monitoring devices, such as neuromonitoring devices and weight monitoring devices, diminished as hospitals became primarily focused on the COVID-19 pandemic. The pandemic has led to a significant increase in the demand for remote monitoring and patient engagement solutions. COVID-19 has led to a significant surge in demand for patient monitoring systems, and manufacturers are increasingly focusing on expanding production to meet the increasing need for respiratory monitoring devices, multi-parameter monitoring devices, blood glucose monitoring devices, cardiac monitoring devices, temperature monitoring devices, pressure monitoring devices. Furthermore, the market for neuromonitoring devices is expecting to recover the losses by the fourth quarter of 2020. Why this system? Improved access to health care. Patient monitoring bridges the barrier of access by providing care to patients wherever they are and whenever they need it. It can be used to reach patients in rural areas, and connect patients to specialists who they otherwise would not have access to. Improves data-driven clinical decision-making. Patient monitoring benefits providers by improving their clinical insight on patients' status in between office visits and offering them tools to inform proactive care delivery. Cost of care reduction. It enables a diversion and earlier discharge, resulting in shorter lengths of stay and lower cost of care. Patient monitoring has demonstrated significant impact in reducing potentially avoidable ED utilization as well as a reduction in unnecessary hospital admissions and readmissions. Reduced patients' expenses. The patient is able to avoid the associated costs of an in-person visit when they receive care via remote patient monitoring. Patients avoid the inconveniences and expenses of travel, parking, childcare, and/or taking time off. The security of the system will follow the defense in-depth principle, which refers to an information security approach, in which a series of security mechanisms and controls are thoughtfully layered throughout a computer network to protect the confidentiality, integrity, and availability of the network and the data within.
さようなら。